Welcome to Dr. Nasar Shahid Forum for Prevention of Chronic Pain, Chronic Diseases, and how to achieve well-being. We have spoken about lumbar pain or low back pain. What are its causes? What are the structures that can cause the pain? It can happen only one structure. It can happen more than one structure. In each case, the first 4 to 6 weeks is spent in non-interventional, non-surgical, non-injection therapeutic modalities. We can use physical therapy, chiropractor, acupuncture, some oral medication. If they fail, then we do advanced imaging studies like MRI, and then we target specific structure through injections. Now, say if we do all these injections and still the pain is significant, what we should do then? So today I'm going to talk about those advanced procedures as a pain physician. I'm not going to talk about the surgical modalities right now. We have not yet sent the person to the surgeon because we are just treating the pain first. There is no neurological worsening every day. If that is the case, if there is a neurological worsening, that the weakness is worsening, the loss of sensation is worsening, the person has bladder and bowel dysfunction, we probably want to send this patient directly to the surgeon. We don't have to try injections at this time. However, if the pain is the main problem and there is a mild asymmetry of neurological examination, but it's not worsening, again, the injection could provide a better and more optimum relief. But say the injections don't give us relief, or it gives us relief, it is temporary and a pain comes back. Then there are two kinds of advanced procedure we still can do before we think about surgery. One is for the disc problem and the other is for the joint problem. Now, for the disc problem, we do percutaneous discectomy. Percutaneous discectomy. That means through a needle, we can decrease the pressure of the disc. Now, it's not a big procedure. It's a very simple procedure because nowadays there are different ways to enter the disc. It's very safe. If you think this disc is the source of pain, so you enter through the disc with a needle. And once you are there, you put a contrast and see if this disc is the source of pain. The patient is still awake enough to give you the idea that once you pressurize the disc, the person says, yes, this is the pain I feel. Now you can give him after that a little more sedation. You can take a disc mechanically out, or you can ablate the disc, evaporate the disc and clean it. The second part of this same percutaneous discectomy is while you are coming back, when you are through that hole or the weakened annulus part, the ligament part, you can ablate it by heating it. So it will denature the protein structure, and as a result of that, that area becomes strong. So this is the percutaneous discectomy for the disc. It doesn't take much time, it is safe, it has to be done naturally by those people who have acquired the expertise. The second advanced procedure I want to mention is the facet joint. If the facet joint, you did diagnostic facet joint injection either by blocking the medial branch or the nerve going to the joint, or getting into the joint and giving some relief, but the pain still keeps on coming back, you can do radio frequency ablation of those nerves. Now, radio frequency ablation of those nerves is again a very simple procedure. The specialized kind of needle goes over the nerve which is going to the joint. This time we are not going into the joint but on the nerve, and then connecting it to a radio frequency machine. The radio frequency heat will create a lesion in the nerve. Now that lesion will cause a discontinuity. Remember, this nerve is now doing the only function of carrying the pain message to the brain. It is not providing any other good function, rather it is now just carrying a pain message to the brain. So by creating a lesion through radio frequency, you are causing that discontinuity of message, and the person can now live relatively longer pain-free window in which you can strengthen his muscles so that the facet joint loading is decreased and the facet pain can be better for a longer period of time, because the nerve will regrow, but up to 6 months to 1 year he can or she can live without much pain. So these are the two advanced studies. Again, you have to make sure that the nerve which you are ablating, you are on it. So before you put severe heat of 60 to 90 degrees, you want to make sure you are on the nerve. For that you can check different ways. There are one is you are checking anatomically, the other is you are checking physiologically. You are moving, giving a stimulus to the nerve and seeing whether there is an effect of that, and the person is relatively awake so that he can tell you also, or she can tell you, that the patient pain is not going into the legs, it's only discomfort over the local area. So in this way safely these procedures can be done, and it can help you get rid of the severe pain that is causing dysfunction. Remember, when we talk about the low back pain, we are talking about dysfunction of the body, because the whole body is connected to that center of the body, and so lifting, walking, doing things that can be a problem for a person who has continuous severe low back pain. And this is the way you can safely understand and treat your low back pain. So I recommend that before your doctors tell you about some procedure, you want to do this understanding of that procedure, and you can review previous vlogs about low back pain and similarly in the neck pain. So I'm going to go over these specific syndromes. However, still there might be few questions left. You can comment, you can describe your experience, and you can contact directly our office if you need a direct consultation. Remember, these modalities I'm mentioning, you have to go through under a supervisions. These are not that any treatment I'm mentioning you can use it on your own, because these are important things. Sometimes for an individual you need specific more unknowns, specific unknowns which you may not know, and it may not have been covered by this small vlogs. So remember, these are the simple guidelines, and this is the disclaimer that you have to use these treatment modalities under a healthcare providers.